Hi, everyone. Thank you so much for tuning in for this lecture. I'm really excited to share more about supporting people during pregnancy to exercise and move day to day with confidence and strength, and for hope for the future, whether or not they're experiencing symptoms. So this is the lecture portion. The lab, we will get into lots of movement and practical application of this information, as well as some other learning. So I can imagine what you're thinking. I'm not really interested in working with pregnant people. Maybe it's not a population that you've thought much about on your different clinical placements, or maybe even as you've gone through physiotherapy school and within the different lessons. Pregnant and postnatal people are not a special population. There are so many people in this world that are expecting, and so many people that are newly postpartum. Now, today's lecture is going to definitely focus 100% on exercise during pregnancy. But again, this is not a special population. And of course, you know that I would not say that and have that minimize their experience or be like, oh, they're not special. The reality of that statement is that we have to feel comfortable as physiotherapists supporting people who are expecting, because they are going to come and see us, and we've got a lot of great literature that speaks to how physiotherapists can really support people during pregnancy. And I, of course, today I'm going to take you through information for helping to support the pregnant person with more of a lens of supporting exercise. So let's dive right into things here. So I want you to think about this question, and you might even just pause the video for a little bit and make some jot notes on your notes or on a separate piece of paper. But my question for you is, how can we, as physiotherapists, best support an expecting person's health during pregnancy? How can we best do that? As primary care providers, again, you will see pregnant individuals come through your door, whether you are working publicly or even privately, or probably you will see pregnant people in your practice. You will, if you are working private, and you might even come across them when you are working in the public system, depending on where you're at. So how can we best support an expecting person's health during pregnancy? My bias is to get them moving. So when it comes to pregnancy, we want to think about movement as a spectrum. I like to think of that for general population as well, but movement is really a spectrum of different ways of moving, lots of different times throughout the day that we're moving. So this lecture, I'm going to focus a little bit more on exercise, but remember that when we have someone who comes and sits in front of us, even if their goal isn't to exercise during pregnancy, you can use some of these concepts and this information to apply how you can support them with day-to-day movements, which essentially are exercise as well. So thinking about it on a spectrum, and having day-to-day, and then on that continuum is also having organized, meaningful, and planned experience or leisure activity or exercise, okay? So again, my bias is definitely to get them moving. So again, welcome to this lecture, Exercise Prescription for the Expecting Person. My name is Myranda Reimer, and I am a physiotherapist here in Saskatoon. I have my kinesiology and Masters of Physiotherapy, both from the University of Saskatchewan, and absolutely love Saskatoon. Love Saskatchewan, grew up on a farm. So I'm really passionate about sharing how we can best support the expecting person. And this is from a physiotherapy perspective. And I am so grateful we have such a broad scope of how physiotherapists can help to support people. And I think that this is such a powerful, even introduction to this information as you continue on with your journey of being a physiotherapist, or even if you go a different direction and become a different healthcare provider, you are still going to run into expecting people. So let's go, let's dive right in. So my bias is also to take a biopsychosocial approach when I am working with people in the clinic, but also in the gym. This, as you know, is an evidence-informed approach, as well as a clinically informed approach. Now, as you transition from school into clinical practice, you will start to feel more confident and comfortable with the experiences that you're having and applying the research and the knowledge that you learn in school, and of course, any of that other continuing education that you may decide to engage in. So the biopsychosocial approach comes up multiple short times throughout our schooling, and then you may even have it come out in your practice when you've been on placements. I cannot encourage you enough to really consider this approach in combination with a biomedical approach. So really the biomechanical model that we have for guiding us with evaluation and then treatment for people and providing rehab or prehab, which we're going to talk about soon, really fits into a biopsychosocial approach. So we're not losing anything. We have everything to gain when we take this approach. So again, the biology, the physics, the physiology, combined with our understanding that we have a mind, we have emotions, we have the ability to think. So the psychology aspect, the mental wellness aspect of the human being, and then also that social, the support. And I don't get into it too much today, but this is something that really has an effect on the expecting person, especially if they start to experience symptoms. Social aspects, whether that's immediate family or extended family, maybe even friendship circles or community, connection is so important. And then remembering that all three of those aspects are so interconnected, we can't really separate them out. So anyways, let's not get this too long. As you can tell, I like talking about that as well. So if you have any questions, of course, please reach out to me afterwards. Now today, using a biopsychosocial approach, we are going to touch on the benefits of a multidisciplinary approach when working with a pregnant person. I'm going to take you through very briefly a little bit of information for subjective history taking when you have a pregnant person sitting in front of you, and those special considerations. We are going to talk about mental wellness. This is equally as important, and maybe a little bit even more important than the other aspects, because again, our body is a vehicle, it is a instrument, and our mind is really helping to govern our experiences, because our mind influences how we feel and then how we act, being the physical. We're going to get into the physiology, some considerations that are different for a pregnant person versus a not pregnant person. Touch maybe a little bit on symptoms kind of throughout, not really specific, because that's where continuing education can really come in. And symptoms will kind of fit into subjective history. And then of course, exercise prescription. So let's get started with multidisciplinary. So working as a team is always a good approach when it comes to providing care. And naturally, an expecting person has medical considerations because their body is going through change. Now, they can have all of the same providers that they may have within their circle of care outside of pregnancy, but there's also some other potential care team members that are supporting them that can be really helpful to understand who they're working with, but then also potentially connecting with them. So here within Saskatchewan and across Canada, when you find out that you are pregnant, you let your general practitioner, your primary provider know, and they may work with that individual for a little bit of time before referring on to an obstetrician. There are some family physicians who deliver babies. So I have found that some clients aren't going and seeing other practitioners like obstetrician, but I would say that there's probably a far more number of people who, once they become pregnant, transition and then also have an obstetrician as well as their family physician to have medical support from. Obstetricians, you may hear them referred to as OBGYN or OBGYN. So they are specialized gynecologists in the world of pregnancy, labor and delivery, and then also postpartum care. If the expecting person applies for a midwife and receives a midwife, they will not have any interactions with an obstetrician. So you either have the support from a family physician, midwife, or your obstetrician who's really going to help to guide that expecting person through the more medical side and leading up to delivery for their care. And like I said, they might be seeing any and all other providers. So maybe they see massage therapists already, or they have questions about massage therapy in pregnancy. Chiropractors, naturopaths, they may have a psychiatrist that they're already working with, but maybe that's something new that they're exploring because they're having increased anxiety. They're noticing that they're having a peripartum mood change or switch, or maybe their provider has noticed that, or maybe they decide that they want to go and talk to a counselor for whatever reason. So like I had mentioned, it's always a good idea to work as a team member when we are wanting to provide care, because we have our scope of practice and other providers do too. And we want to really put that person in the center of their care team and really strive for that client-centered care, that client-informed approach, and having them feel empowered and not feeling like they don't have options, but more of getting all of those different options and then choosing who they want to work with and what approaches they want to take. And so as you get out into your own practice, it might be helpful to connect with someone in the clinic that you work in, or maybe in the public division that you're in that works with expecting people if you're not really wanting to do that. Or at the very least, just understand the resources and be able to guide that person if you're not wanting to exactly provide that specific care. Just like you would for any other client, right? Okay, subjective history. So what is our role as a physiotherapist when someone comes and sits down to meet with us for the first time? Well, really, we are doing a subjective history screen to get to know that person and then really clear any red flags. Is this person that's coming to see me appropriate for my scope of practice and medically appropriate? So we're going to dive into some specific considerations for the expecting person, because this really sets the stage for us understanding how we're going to be able to, or what approach we're going to be able to take with that person, depending on what's going on for them right now, something that could come up for them later medically, and then of course just understanding just in general where they're at and what their history has been, so that we might be able to not predict, but maybe help to mitigate any risk of symptoms developing or of bigger concerns happening. So like I mentioned, someone comes in, they sit down and they let you know that they are pregnant. Maybe they are coming to see you because they have a pregnancy related concern, and maybe at this point you are providing perinatal physiotherapy, but maybe they come in, they sit down and they tell you that they're pregnant and they're having back pain. So or maybe they're having referred symptoms down into their arms. Their doctor just told them that they have carpal tunnel. These are all questions and information that you can use to screen that person in front of you and really get to know them. So clear those red flags in the way that you would any other person. They're coming to you with a musculoskeletal concern. Learn about their past medical history. Learn about any surgeries that they've had. Something that is specific for pregnancy is, have they had any laparoscopic procedures before? Maybe they've had a LEAP procedure where they go in and they take away any questionable looking cells from the cervix. You know, this might help give us some information about why they're presenting with symptoms that they are, a piece of the puzzle. And then, of course, any specific to pregnancy considerations or concerns. And I find that you have to differentiate. You ask people about their past medical history, but then ask them specifically, is there anything that your provider has told you that is a risk factor for you, something that we should be specifically monitoring, or is everything good to go as far as you know, and you don't have any concerns? Specifically asking ensures that nothing is being overlooked, because there's lots of things going on for this individual, like everybody else that comes and sees you, and sometimes people forget. Ask them about medications that they're taking. Are they taking any vitamins? Pain management in pregnancy, there's recommended certain types of pharmaceuticals. So understanding those just really like briefly, and just even the names and those recommendations can really helpful. If somebody comes in and they're asking for pain, they're okay with taking medications and they want pain management, but maybe you also see on their medications list that they've listed an antidepressant, but they didn't share with you that they do experience depression. You might not bring it up, but you're putting that to the side in the back of your mind, just as a yellow flag, because we'll get into this with the mental wellness aspect. So I'll just pause there. Most people are taking prenatal vitamins. Most people start taking those sometimes even before they're pregnant, because they're planning, or they start when they find out that they're pregnant. As a part of our lower quadrant scans or upper quadrant scans, again, we're clearing red flags. And specifically with lower quadrant scans, we're asking about perineal paresthesia. We're asking about changes in bladder or bowel function. And so you can just think of this as an extension of those questions and screen for pelvic health concerns or symptoms. So you don't have to get really intense with asking these questions, because you might be like, oh, maybe nervous yourself as you're learning to ask these questions. Maybe thinking, okay, why would this person think, why am I asking these questions? Maybe they don't know about pelvic health. So really simply, if I have people come in with low back pain, pelvic pain, hip pain, abdominal pain, I let them know that I'm going to ask them some questions about bladder or bowel control, because that might give us a little bit of information about what might be influencing their symptoms. So just asking very simple questions after prefacing that. Have you noticed any changes in your bowel or bladder control? Do you have any unwanted leakage or any pain in your pelvis? And then you know, from a pelvic health perspective or women's health perspective, we might be a little bit more specific to and ask if they're having any pain with intimacy. We might feel more comfortable asking them about pain with menstrual product use. Asking about tailbone pain, lots of people aren't really sure if they should ever mention that. So that would definitely fit into a symptom within the pelvis. Asking about Paris. So have they been pregnant before? Is this their first pregnancy? Maybe it's their second, third, fifth, eighth. That can give us a little bit of information about their history, and then might even open up the conversation of asking them about their past pregnancies or past symptoms during pregnancy. What I had meant to say was past deliveries might give us some information about where they're at right now. And then, of course, past experiences in pregnancy with symptoms or pain. Abdominal considerations. So again, this might be asking them questions about surgery. Have you had any abdominal surgeries? You know, some people might forget that they've had a hernia or they've had a hernia surgery because it's just in the past or they're not really symptomatic with it. And when it comes to pregnancy, hernias are important to understand for a number of different reasons. So definitely screening for that. In your subjective history, this is a really great way to get to know the person in front of you. Ask them about their individual goals, their short-term goals. They're coming to you, they say they want to keep moving throughout their pregnancy, whether that's exercise or just feel comfortable and confident in their body. They want to feel strong as they go throughout their pregnancy. So ask them a little bit about what they think might be helpful for them to do that. You know, they live in their body, they know themselves best. So asking those questions about their goals can be really helpful. And then I find when we ask people what their goals are for the session, we really get to the root of what are they looking for. And at the end of the day, we're providing a service. People are coming to us expecting service. So why not ask them what they're looking for and then mold that information and education that we have around what they're looking for. And you're not going to leave with a dissatisfied customer. You're going to leave with someone feeling so heard. They are going to have a plan. They are going to feel excited. They can't wait to tell their friends. And that plays a part in their journey and their experience with symptoms and all of that. So I just love bringing that up. I find it really, really helpful in then how I, in my mind, structure what we're going to go through in the session. Just as a little aside, prenatal appointments, there are a lot in pregnancy. There are far more prenatal appointments for medical providers in pregnancy than there is postpartum. That's another conversation. But even just understanding and pointing this out, they're going to see their medical professional quite often. So if something comes up and you need to liaise with them, do so. But asking them every time you see them, is there anything new? Has something come up? That's really important. Because when they come to see you the first time, they might not have any changes in their blood pressure, but maybe the second time they come to see you, their doctor now has concerns about preeclampsia, and that is increased blood pressure that during pregnancy that could potentially damage other organs or cause symptoms that really aren't helpful for that individual naturally. So sometimes people change and they forget to mention things. They're also having lots of different appointments, so we have to be understanding and kind of have their backs with that, because they've got lots going on and we're writing things down, and I encourage clients to write things down too. So awesome. That's a really brief overview of subjective history. So within subjective history, I had brought up a little bit about mental wellness, understanding maybe if they have any predisposing risk factors for mental health concerns during their pregnancy. And really, something that I've been really noticing with lots of the clients that I'm working with, during pregnancy and then especially postpartum after birth is there's a huge identity shift for people who are pregnant and then transition into parenthood, motherhood. We're really working on exclusive terms here to include all people that may find themselves pregnant. So there's a big identity shift. And for some people, there might be so much change and they're not sure how to navigate it. I don't want to go as far to say that I feel like people maybe have an identity crisis, but this is just not something that gets talked about enough. And with new challenges and lots of changes, so much information out there, people really come to me saying that there's so much conflicting information. They don't know who to ask. They don't have time with their doctor to ask all their questions. And then now on top of that, there's a pandemic. So mental health is so important in every single aspect of care and in every single aspect of life. We have to think about it in pregnancy. So mental wellness. So I am coming at this from a psychology-informed physiotherapy approach. Again, within the biopsychosocial model, we understand the influence of mental health and wellness on our physical health and that connection. So that's the importance of our subjective assessment. That's why we're asking questions again about their medical history, their medications. We're also wondering if they're seeing any other providers. Now, because we are psychology informed, they may mention that this is what's going on, but we're not really poking and prodding to find out the nitty-gritties of that and really asking permission if that's something they want to elaborate more on, and also letting them know why we might be asking these questions, because if it's the first time they're coming to a physical therapist, they might not know that the psychosocial aspect is important. They might not know that within the role of a physiotherapist. So we want to make sure that they're informed of the care that you're providing, especially if you take a psychosocial informed approach. Something that just like makes my heart sing so much within physiotherapy is that we get the time to build rapport with our clients. We can spend 45 minutes or an hour, depending on where you work, in the private section. You might have control over how long your follow-up appointments are. I spend an hour with everybody the first time I meet them, and then depending on what they're looking for and what we think might help them, I offer 30, 45-minute, and 60-minute follow-ups. And this is just so fantastic because building that rapport can really help people find comfort. There is some research talking about having consistent providers being very beneficial for the expecting people. And we have the opportunity to really create a safe space. We are professionals that are all about active listening and asking questions. And my approach is really to hear the person and help guide them in a direction, but not tell them what to see. And I think that's a big part of how we can incorporate that awareness to mental health, is just letting people know that it is something that's okay to talk about and that there are people out there that will listen. So because we have more time, people might open up and share that when they might not in another appointment with maybe their gynecologist or their obstetrician or family doctor, because they don't have the time. Again, it's huge, right? And then as the physiotherapist, we naturally ask people about sleep. And pregnancy can be a really challenging time for people and finding rest and sleeping. So if they're mentioning that they're getting poor sleep, does that increase their risk for mental health concerns or mental fatigue throughout their day? What about their nutrition? Maybe they're having nausea, also known as morning sickness. For most people, it's not only in the morning. For lots of people, it's throughout the day. So I really just refer to it as nausea, and then ask them what time of day, if they bring up that they're having troubles eating, that they've been throwing up. And then we can screen them and let them know too that there's professionals that can help them. I work with a registered dietitian here in Saskatoon, the owner of Vitality Nutrition, and she does a lot of work with ladies to help them manage that nausea in pregnancy. Physical activity levels. This is important and ties in with mental wellness. Did they just get a diagnosis that says that they've got some precautions for exercise or day-to-day movements? Have they been told that they can't exercise? And how is that impacting their mental wellness based on their expectations and their lived experience and what they love? Again, I touched on nausea, energy systems. Naturally, people are more fatigued. They're growing a little human. So, you know, how is that playing into everything that's going on in that big picture for them? And, you know, lots of people want to feel heard. So I find that asking people about their background with exercise, especially specifically if they're coming in wanting to exercise, can be really helpful, because then you're understanding the level of intensity that maybe they're used to doing that might bias their goals or their expectations for exercising during pregnancy. So that's really important, because pregnancy is not a time to push boundaries. It is not a time to be reaching for personal bests. So if you've got somebody who comes from a high level background and they're in pregnancy, they're conditioned and trained to push through symptoms. So we might have to kind of help them navigate or help not navigate, but maybe highlight or talk about, you know, their increased risk of maybe athlete brain and pushing through, or kind of having this all or nothing mindset that, especially if they're having symptoms. Well, if I can't do that, well, I might as well not do anything at all. Or I want to do this so bad, I'm just going to push. So we really have to find that middle ground with them, and understanding where people come from with their background of movement and exercise can be really helpful, whether it's health, fitness, or sport. We are primary care providers, so we can screen, like I said, for mental health concerns and then refer out to make sure that this person is really getting the support in every aspect that they need for their journey through pregnancy and life. Baseline mental health concerns, we talked about that in the subjective history. I wanted to provide some resources for you. This first resource here is really helpful for understanding and how you can identify patients at risk for perinatal mood disorders. We can also look to, this is fantastic, the American College of Gynecologists. They have a document for screening for perinatal mood disorders as well. They also have within there the questions of the Edinburgh, it's postpartum depression scale, but I think they tweak it a little bit to say that we can use it in pregnancy as well. And then, you know, the American Academy of Family Physicians also has a pretty good resource there. So have a look at those if you're curious, but then also if you're going to choose to support this population. All right. Pregnancy basic physiology. So physiology just being a bit of the term just for like understanding anatomy, understanding the interaction of the systems really within a living organism. So we are going to just touch briefly on some of them, not go into a lot of detail. Definitely this is what comes out in courses that you take. So pregnancy related considerations. So definitely looking at a lot more of the biology here within that biopsychosocial approach. So we have musculoskeletal changes. There's lots of different research out there that speaks to pregnancy related posture changes, potentially because we have a change in our center of mass. We have increased demand on adapting tissues. And, you know, some people really believe that postural changes are terrible, are really bad. We don't have literature to say that increased lordosis causes pain. We have that information outside of pregnancy. And then we also have some of that research within documented information within pelvic girdle pain, lumbopelvic pain, and I'm going to share a little bit more about that in the next couple of slides. And then there's a lot of myths out there too, that in pregnancy, your hormones make your tissues lax. We're finding in the research that that is not the case. Words are so important. I can't emphasize enough that we have to be very conscious of the language that we use with people. They are coming to us for information and guidance. And if we tell them that your ligaments are lax and that's why your pelvis has shifted or slipped out of place, how do you think that person is going to feel when they leave their room, when they leave your treatment room? And how do you think they might start to move? And what do you think they might start to believe about their body? Now, that's all speculation, but we do also have some research that talks a little bit more about people's beliefs and their biases and their attitudes and the meaning that they place on words and information that we receive, but then also on their physical selves. So there are hormones that influence our tissues during pregnancy, but they do not make our ligaments or the expecting person's ligaments so lax that things are going to slip out of place. That would be a really, really poor evolutionary adaptation for us in one of the most important times of human life cycle, to have people who are pregnant be like so vulnerable and just fall apart. So our literature is starting to point out that we are not lax and going to fall apart. And then just from a logical sort of thought perspective, that just seems kind of outrageous, especially when you say it that way. And so I let people know this is one of the myths that I just break, even if they don't bring it up, because it's out there and it's just so not right anymore. What we are finding in the research is that the hormones do influence the tissues. And because the ligaments or the soft tissue is influenced, it might also be a little bit more sensitive. So yes, there are adaptations and changes, but there's also increased sensitivity to those tissues because they're adapting and changing. And something that changes is our core. And our core is really all about pressure management. So musculoskeletal changes may influence our respiratory diaphragm, our abdominal muscles, their pelvic floor muscles. So really understanding musculoskeletal changes are right within physiotherapy scope of practice. So even just understanding them at the basic level, you can really help to support people and maybe refer them on if it gets to a point where you don't feel comfortable anymore. Cardiovascular changes. There is increased blood volume. So that means that there's increased cardiac output. Their cardiovascular system is working more intensely, and there's increased demands on it. So that's also a consideration when we think about exercise. There's changes in blood pressure, and blood pressure is something that's monitored when they go in for all of their assessments and checks. So I find that asking about blood pressure is really important, and we're not necessarily as concerned about heart rate anymore. Heart rate is really relative to the individual. So yes, there are cardiovascular changes, but if you have somebody sitting in front of you that's used to doing high intensity interval training, their heart rate range and their max heart rate is going to be different than somebody who walks leisurely their dog 2 times a week, right? There's going to be that difference. And some of the recommendations that we have aren't really even mentioning heart rate anymore, but definitely something that people can use 100%. I'm not saying that it's not important, but it's not, we're not putting as much emphasis on it anymore. But blood pressure is definitely one. Whoopsie. that I would say we definitely want to keep in mind. Cardiovascular changes, or cardiorespiratory changes. There's changes to the rib cage. Baby's growing, baby has to find more space, the body has to create more space. The rib cage naturally changes. Does that equal pain? Not necessarily, but maybe somebody is having discomfort and they're holding everything really tight, and the body needs to expand, and you notice that when they're breathing, they're really apical. You know, you might introduce this idea of 360 breathing or deeper breathing, diaphragmatic breathing, not because they're breathing wrong, but maybe because their body needs to have an adaptive change, and maybe because it's painful, they're holding on to that, and you might just say, hey, let's try something different. And really explain to them that these changes are adaptations. It's not something to be feared, and that they can get through it, and you're going to try a couple of things. And naturally within the cardiorespiratory system, we have the diaphragm, and that respiratory diaphragm has less and less room, like the other organs in the trunk are getting pushed up and having to move in different places. And so the respiratory diaphragm also has to accommodate for changes, just like the other abdominal muscles and just like pelvic floor. So really, really basic, but just to start, get your thoughts going about, okay, pregnant people, not a special population. This is all pretty basic physiotherapy stuff that you can just start to dip your toes in, and if somebody comes and sees you, you've got lots of skills that you can help them with. And then of course that continuing education is going to be really important, because you're not just going to stop here. There's a lot of fear about exercise and miscarriage. We do not have research to say that there's a correlation or causation between exercise and miscarriage. It is something out there that people are fearful of. And just naturally, if people do have a miscarriage, they might wonder if exercise influenced that. And so there might be some fear coming back to exercise or exercising during pregnancy. So understanding the research, and then, you know, if you hear that fear and they share that they have trauma from before, that also highlights to you that they might be supported with another care provider, more on that mental wellness side. So it's all interconnected, right? So boom, the core. One of the biggest areas influenced by pregnancy from a physical perspective. I absolutely love this illustration. This is Tracy Shear. She is the pelvic guru. She has an absolutely fantastic pelvic health membership option. And when you have the membership, you have access to these awesome pictures. So I love this picture. This person, we're looking at the interior or the interior posterior wall of the trunk, and we can see, wow, we can see the diaphragm, we can see the QL, we can see psoas and iliacus, we've got pelvic floor, love this view of the pelvic floor, and then also naturally we've got the abdominal muscles. So the core really wasn't a thing, so I'm told, about like 15 to 20 years ago in physiotherapy practice. It wasn't really until like lots of research with like low back pain, they started looking at transversus abdominis, and then, you know, it kind of took off in the fitness industry and stuff around that time. So I'm told from my mentors, because like ever since I've kind of been alive, like the core and six pack is been a thing. But something that we really have to reframe for people when they come to see us, if they have questions about their core, I find is helping them understand what our core is, and what that means in pregnancy and how it changes. Because the fitness industry and diet industry really focus always on the front of our core. But our core really has a front it has sides, it has a back, it has a top, and it has a bottom. And essentially our pelvic floor muscles are just the bottom of our core. And our respiratory diaphragm is really the top of our core. And so there's this conversation out there and some different approaches about we've got an inner unit of our core, which would be our respiratory diaphragm, our pelvic floor muscles, and then our transverse abdominis and multifidi. That's kind of when people talk about inner core unit, they're kind of referring to that. And that's, you know, when we're at rest, more of our postural control system, and also influences our intra-abdominal pressure. Then we've got our outer core unit. There are so many different muscles that we might consider to be our outer core unit. For the abdominals, it would be our obliques, internal and external, and then of course our rectus abdominis. Some people like to include quadratus lumborum. Some people almost will say like our lats because they're connecting, coming so far down. People might also talk about the hip flexors as being a part of the core system. So really, that is an approach. I kind of only get into that sort of information with clients if needed. The biggest thing is letting them know that our core is all the way around us. We have a top and a bottom. And during pregnancy, there's increased demand on our core and on our trunk. And considerations are, how can we best help to support this adaptation that is going to happen within the core? Abdominal wall changes are not something to be feared. There's been a really heightened awareness and a lot more attention to abdominal muscle separation and diastasis abdominis recti. And so what that is as the core adapts to needing more space because baby's growing, the skin, our connective tissue, our fascia, our abdominal muscles are all lengthening. And at some point, we need more space. And so our linea alba, that connective tissue right at our midline, running vertically, has to adapt as well. So 100% of women in their third trimester will have abdominal muscle separation. And then postpartum, everybody's experience is quite different. And the postpartum core is a big part of recovery, and also a big source of fear and misinformation for people as well. So redefining the core and letting them know that abdominal changes are natural, and that our pelvic floor muscles are there at the bottom of our core. Really learning about the whole system can be really, really helpful. And there's lots of courses out there that we can take to learn more about the core. And I really, really encourage you, just from a general physiotherapy understanding, no matter where you're going to be practicing, to learn more about our core, because it's something that's important for all of us outside of pregnancy, outside of having kids or not having kids. It's important for men. It's important for women. It's important for every single person, regardless of how they identify. So then we've got specific considerations that we're going through for pregnancy, but really important. And actually, I would encourage people to take external pelvic floor muscle palpation courses, and we'll go over a little bit of that in the lab. But because it's another muscle of our body, and people, if they're having back pain, what's our core? All the way around us, top and bottom. So if we're having back pain, we need to think about the rest of the system. So maybe we're considering pelvic floor, or we want to at least rule it out that that's not a contributing factor, right? I could go on forever. It's awesome, super fun. This photo, love it. So just take a second to orientate yourself. We are looking at someone from underneath. So we're really looking at the inferior aspect of the pelvis, and from the back, kind of on a diagonal up. So I love this picture because it really shows us pelvic floor and how it's supporting at the bottom of the pelvis. And then we can see that we've got obturator internus coming and attaching on to the femur. And then this is, I believe, piriformis here. The gemelli muscles are not here because most of the time when we talk about pelvic floor attaching to the hip, it usually just shows obturator internus, and then of course piriformis lives and is really interconnected with the pelvic floor as well. So another reason to understand the pelvic floor muscles or the whole core, because you might have somebody come in with sciatica type symptoms, right? And boom, what's right by piriformis? Pelvic floor. Yeah. Yep. Really important. Did I just do this on camera? Yeah, I did. Anyways, just feeling really comfortable and relaxed. Hope you're feeling comfortable and enjoying the material so far too. So we're getting into some of the better stuff here. So exercise prescription in pregnancy. Let's get into this. So physiotherapy role, our role is really to help build capacity through the trimesters if we decide that we feel comfortable to help this pregnant person navigate their entire pregnancy journey. If you don't feel comfortable with that, that's totally okay. But I still think that this is super valuable to understand and have this awareness so that you can refer people and then also kind of see, okay, what are your thoughts on this information? Because it's a big area of physiotherapy. It's an exciting area, and just like lots of all the other ones too, right? Like balance or dizziness or shoulder. Maybe you want to work with post-operative patients, right? This pregnancy is just an aspect of that whole scope. So building capacity. So we, as physiotherapists, have a focus and a goal of helping to support people with movement and exercise. And we have level 1 evidence, and that being systematic reviews of randomized controlled trials. We have evidence that says that exercise helped to decrease the severity of pain during pregnancy and the early postpartum period. This is perfect. This is exactly what we want to see in the literature. So this 100% suits my biases. And, you know, there were limitations to this study. So we can't always look for research that's going to affirm our biases. We want to look for information that's going to play devil's advocate. But, you know, this suits my bias because we want to hear that exercise is helpful. This randomized control trial from Davenport et al. 2019, I believe it was 13 or 15 randomized control trials. So they were looking at the, people who didn't exercise and people who did, and the people who did, the intervention was anywhere between 1 to 14 times per week of exercise throughout those studies, and the duration was anywhere between 20 minutes to 75 minutes, and the intensity really varied, so low to vigorous levels of intensity. All of this showed to support. So isn't that fantastic? We're getting evidence to support that movement across the spectrum of intensity at a wide variety of times per week, and then even duration can still be helpful. Now, something really important to point out is that prenatal exercise was not associated with lower odds of pain during pregnancy. So just because somebody exercised during pregnancy didn't mean that they wouldn't have pain, but exercise was a way that they could find support for managing symptoms. And then naturally, if we, which we'll get into a little bit here in the next couple of slides, but if we have people having symptoms and we tell them to stop exercising, we're not only compromising that person during pregnancy, but we're also potentially compromising their resiliency after birth. And we're also affecting a number of different systems within their body: cardiovascular, cardiorespiratory systems, right? What about our musculoskeletal system? What happens when we stop loading bones? So 1 in 5 women may experience pregnancy-related pain, that being pelvic girdle pain, low back pain that's related to pregnancy, like a new onset in pregnancy or maybe heightened because of pregnancy. And then also lumbopelvic pain. So that's what LPP stands for. So if 1 in 5 women are experiencing this type of symptoms and physiotherapy is shown to be helpful, this is just awesome. And we know that pain is probably going to come up, or symptoms are going to come up. So why not talk about it and let people know that there's support? Because there's lots of old approaches that just say, you can't do anything about it. Your pain will go away once your baby comes out of you. How dismissive and inaccurate. Thank goodness there's people talking about this stuff, right? And awesome professors who want this information included in practice when we're in school. So great. Just the evolution, right? And I wouldn't be where I am today if it wasn't for people advocating, and then I heard about this, right? My passion comes from a long line of people. So right now I'm talking to you as one, but there's a whole bunch of support behind it. So, all right, pregnancy related exercise considerations. So I'm going to kind of lump for the client and the practitioner together so that I'm not being too repetitive. So there are Canadian physical activity guidelines that are unique to pregnancy. So part of our role as a practitioner, if someone comes to us and they want to exercise during pregnancy, is letting them know what those activity guidelines are. But what if somebody comes to us and they're experiencing pain and they're not really active, or they've stopped being active? We can refer to these guidelines and say that, hey, like there are benefits to continuing to move or start moving your body. What are your thoughts on that? Would you be interested in exploring movement and exercise in the program that we decide is going to help you at the end of our session? Would you be open to having 1 or 2 movements a day or every couple of days? Because some people might not even know physical activity guidelines. And then we also want to understand and help the client understand the precautions and contraindications to exercising during pregnancy. So this is also important why we want to go back to our subjective history. Did this person let you know that it's their first pregnancy and their doctor is maybe concerned about where their placenta is sitting? So maybe they've advised them to hold off on some impact exercise, even though they're in their first trimester, and that's not usually a time where we might take that impact exercise and scale it back. Or maybe it's their 3rd pregnancy and they're already having a thinning of their cervix, or their cervix almost already seems a bit dilated. How is that going to influence our approach to helping them exercise, or the recommendations that we have for them with day-to-day movements? Also helping to provide them with information about their core, which includes their pelvic floor muscles, and considerations for that during pregnancy and those changes in physiology and their physical body. And so from a practitioner perspective, this is where a lot of that continuing education has to come. It is more than just changing exercises for somebody during pregnancy. We have to understand those changes in the physical body and why we might make the recommendations that we do, so that we're not just saying things outside of the research or not being as thorough as we could be. And, you know, traditionally, exercise guidelines have had a lot more of an emphasis on keeping babies safe. But the recent 2020 American College of Gynecologists guidelines and recommendations for exercising during pregnancy really came out and talked a lot more about mother considerations, which is absolutely fantastic. So those guidelines now have considerations for the expecting person and also considerations for baby. And I think that that's awesome, because then part of our role might be with how they are going to help manage urogynecological concerns, so bowel or bladder concerns, you know, pain in their pelvis, things like that. And that's really where we want to have that multidisciplinary approach, because something might come up and we need to confirm with their provider what they're actually wanting the client to do. Because if there's any sort of feeling that the person is maybe sloughing off what their provider said, like you know, not expressing the severity of it, or being like too overcautious, we're not going to pressure the client into doing something one way or another, but our role is to be informed and do our due diligence to understand that. So connecting with their provider is important. And then also pelvic floor muscle related concerns and the role that pregnancy plays on the pelvic floor. And then something that's really big for people is we have to identify as a practitioner, but the client also has to identify what their level of readiness is. And what I mean by that is they're coming to you, they want to ask you about exercise, or where are they at? Are they exercising really highly intensively? Have they not really been doing much and they want to ramp it up? What is their routine like? They're coming to you and say they're looking for guidance, maybe not exercise at all, but looking for guidance. If they're telling you that they're stressed, if they're telling you that they're a nurse and they work 12 hours, if they're telling you that they have other kids, the best approach for them might not be exercises 7 days a week and 5 of them. We have to help find the difference that's going to make a difference for them. And that might be only 1 or 2 things, because their level of readiness is only going to allow that. Versus somebody who comes in and says, I've got 2 kids at home, they go to daycare 3 days a week, so I'm willing to do kind of whatever it takes, and I've got a lot more time. Well, you might be able to say, okay, well, 5 days a week, I think, if you want to, let's give you 3 things to try. Or this is how we're going to modify your exercise program to meet what you think you can do. So the client, we're asking them questions about things so that we can understand, okay, what's going to be the best approach for them based on what they're telling me, but also based on my clinical experience with people, and then using that to really create that individualized care program for them. All right, so here are references for you. Things from the previous slide were all things that I've kind of taken from these different resources. And then the core and pelvic floor considerations do fall into these recommendations. But all of the information more about the core comes from the courses that I've taken outside of my master's. So my approach to exercise in pregnancy has really changed and grown over the past 4 years. I've been a physiotherapist now for 4 years, and I've really come to this thought, and I really enjoy this idea that pregnancy is an opportunity for prehabilitation. And exercise is one of the few controllable factors during pregnancy. Pregnancy is so unpredictable, but exercise, we can manipulate and we can mold, and we can make exercise what it needs to be to support that person in front of us. And this is what really gets me excited and going, because we can scale exercise to infinity and beyond. We can scale exercise and movement. So when we're helping people in a time where there's a lot of unpredictability, and especially when we have people who are used to control, we have to help them understand that there's things that they can control and there's things that they can't control. And if we can help them understand in a healthy way that they can control exercise, that might help to decrease their anxiety. But again, we have to help them navigate controlling exercise in a healthy way as they go on their journey. And pregnancy is a really great time to help you learn more about your body for now and as it changes to support for later. And that's really what prehab is. We're learning about our bodies during pregnancy, learning how the body will potentially respond or what the body will experience during birth, and then understanding how the body may be changed beyond delivery and after birth. Pregnancy is a really great time for people to bring awareness to their tendencies. So their mental tendencies, like I said, if they come from a really athletic background and they're used to pushing through boundaries, we want to identify and bring that awareness to their day-to-day life, but also exercise. Maybe there's someone who don't really speak about their feelings or their symptoms more specifically. They're really quiet, they don't share. It's like, hey, it's okay to say that you're having pain because we can help that. And then also from a physical perspective, understanding our tendencies. If we start to bring awareness to when we exercise, every single time we're gripping the bar and tensioning everything, whether it's 10 pounds or our max lifts, we are wanting to bring awareness to how we're controlling intra-abdominal pressure during pregnancy. So bringing that awareness to, hey, I breath hold, or hey, when I breath hold, I bear down. That might be something that challenges the core system, especially during pregnancy, because there's other factors that are increasing the demand on the core. Maybe they have a tendency to, move a certain way, like, for example, really over hip thrust when they're finishing at the top of their squat or their kettlebell swing. Now, is that necessarily a bad thing? No. But is that something we might change in pregnancy to help to decrease maybe some of the loading through the anterior aspect of the core? Maybe, right? So like I said, they're really learning about their bodies and bringing awareness to areas that they may have never thought about before, but we know are heavily impacted during the pregnancy. And if they're going to have a vaginal delivery, know that we're going to have to potentially, and what I would say, like the research bias is, recover those pelvic floor muscles, even if we haven't had a vaginal delivery. So bringing awareness to pelvic floor, bringing awareness to tendencies during pregnancy is super, super helpful. And then, of course, a multidisciplinary approach. Prehab and rehab go hand in hand with the importance and the benefits of working as a team. All right. Another thing with exercising in pregnancy is that the basics still apply. It's not super complicated. There are other considerations, but the basics apply. So when it comes to exercising in pregnancy, language matters. It really, really matters. How we label or speak about exercises could set people up in a way that supports them or really demotivates them or provides them with frustration or feel like they have a loss. Talking about safe exercises in pregnancy, there are things that are maybe not as appropriate depending on where they're at in their trimesters, which we're going to get into. But language really matters. And if you have more questions about that, we can definitely speak more about that for sure. Just because traditionally there's a lot of stuff that gets said to people during pregnancy, especially with exercise, and it can be really detrimental. So we want our language to highlight bright spots and encourage people and empower people. So there's no wrong positions, postures, or techniques. If we say that standing like this is wrong and someone finds themselves standing like that, they're going to start to question themselves. I'm doing it wrong. This is bad. And we don't know if their pain is associated with that posture. Maybe it's associated with them being in that posture for a prolonged period of time. Maybe it's associated with being in that posture because it's a new posture for them, because their center of mass is changing. Does it mean that that posture is bad or wrong? In my opinion, no. So the importance is acknowledging, or what I'm trying to help is acknowledge the importance of the relationship between fear and pain. So the stories that we tell our clients or that we make up why someone might be having symptoms or pain loops back up to why language matters. And again, people come to us looking for that support. So we want to make sure that our language is kind of on point. And maybe it's not as much about the words that we use, but really important that our follow-up explains what we're trying to say. But I would still challenge you to evaluate our language, working with people during pregnancy, but even outside of pregnancy. And, when it comes to exercising in pregnancy, we're not fragile, but we're also not invincible. So chatting with clients, if it comes up, it's saying, physical changes, there's risk versus reward when it comes to different movements and exercises at certain times during pregnancy. So giving them that information and then giving them the autonomy to make the decision for themselves. I have ladies that come in, say that they're having symptoms with running, and I tell them if they don't want to stop running and they want an approach that supports them to keep running during pregnancy because that's what really helps them, I'm not going to get mad at them and tell them that if they don't stop running that they're terrible. I'm going to try and figure out a way that I can help to educate them and provide them with support and subtly nudge them towards potentially decreasing that impact if they're having those symptoms, and then that, and empowering them with that information about their body. But ultimately, if they decide to keep running, I'm still going to be there to support them, especially if they still want to keep coming. But we're giving them that education about that risk versus reward, and then of course documenting that when we're charting. The basics of training principles still apply as well. Individualization, the person in front of you and the task at hand. They are going through physical changes, their day-to-day activities of daily living, their approaches have to change. Their approach to exercise have to change. What are their goals? What's going on? What's their environment? And how can we individualize this approach for them as they go through pregnancy? And specificity. They're gonna have to be carrying things on one side of their body for a long time after birth. So training or looking at the way that they're doing that already or including that in their program, that's important, and that's specificity for the pregnant person. Okay, so single arm carries or single arm holds, single arm lifting. What about rounded back lifting? Unless you are mega tall or you have a tiny crib, they're gonna have to round their back getting baby in and out of the crib or the bassinet. So why don't we start training that to develop resiliency? That's specificity and that's individualization for a pregnant person. And then this is why I love this approach of prehab for using exercise, because it's a unique chapter for people. And it's really one of the only times that we are going to see a very consistent and gradual deload versus us wanting overload. We find people deload obviously naturally in sports, but pregnancy is pretty consistent deloading, I would say, for most people from the moment they kind of find out that they're pregnant, or typically if nausea starts to happen in their first trimester, there's naturally a deload, and then there's birth, and then there's where we're going to be adding an overload. So again, I like this idea of using prehab and this approach with exercise and using words like deload and specificity and training principles. If you have someone who's used to exercise, that might click and help them a little bit better than a different explanation. So naturally, I live in the world of movement and exercise, so I use terms that resonate with me, but then also being able to be creative and find terms that resonate with people who aren't in the exercise world and are just coming because they're having pain every time they lift their 2-year-old and they want to have a pain-free pregnancy and care for their toddler. The basics still apply with modifying variables. So it's not just about modifying exercise. We're looking at modifying volume, load, range of motion, intensity, duration, movement patterns. That kind of fits in with strategy. We maybe are looking at modifying stimulus, right? That kind of fits in with intensity and things like that. But it's important to understand the different variables that we can modify, because sometimes we have to get pretty creative depending on how people go through their pregnancy. So yeah, be creative, have fun, be individualized, and don't overcomplicate things. Seriously, don't overcomplicate things. And then if we're looking at exercise prescription during pregnancy, there's advanced guidance. So it is important as practitioners that we understand the core and pelvic floor considerations, how that influences intra-abdominal pressure, and what that means like for certain exercises and activities. And it's important to have that treatment and assessment and treatment approach as well. Okay, and this is where you're really going to get into that continuing education piece for yourself if this is the way that you want to go, or looking to somebody else in your clinic, mentorship, things like that. And then advanced guidance, honestly, getting into it and understanding the lived experiences of a pregnant person. I remember first starting out hearing so many different things, and it was like, oh my gosh, these are your experiences. And then slowly, with more and more time, you learn about the common shared experiences, and that really helps you start to maybe predict challenges that might come up for somebody, might help you to ask questions that maybe help us understand how somebody is maybe navigating pregnancy, just based on what other people have said. So yeah, there's that continuing education, and then of course there's clinical education and experience that comes along with that as well. All right, so just really briefly here, exercise prescription trimester by trimester. So throughout all trimesters, we are really looking at prioritizing rest. We are looking at nutrition and hydration at being just as important as any other chapter and stage of life. And we're prioritizing that over exercise. This is a different season of life, not a time to push boundaries. So really emphasizing that to your clients. First trimester, we're kind of have people continue as usual if they feel comfortable to do so, depending on symptoms that may come up, nausea or fatigue. And then of course we can naturally modify exercise for people depending on what they can manage and tolerate. Some people with nausea can't do much of anything. Even laying on their back isn't great. So, you know, it really depends. And then fatigue also is really going to depend. The first trimester, pretty much when people find out that they're pregnant, we typically are advising them to discontinue contact or high-risk sports or exercise, because you know, the exercise of weightlifting might not be correlated to miscarriage, but you know, running and playing soccer where there's physical contact and bumping into each other, and you know, that impact, we don't necessarily know that contact within that sport is safe for the reproductive system, or doesn't cause a shock to the reproductive system. So, you know, exercise doesn't have that correlation or causation in the research, but we want to be cautious, and contact sports and high-risk sports definitely put us more at risk for falls and things of that nature. Second trimester, the need to bona fide movement as the abdomen continues to change, right? And so with this, it might be exercises where they're hinging or bending forward, like squats or deadlifts. Their abdomen, they might find they need a wider stance. But then we also have to understand the challenges that puts on the rest of the core system, especially pelvic floor. If we've got legs in a sumo squat versus, you know, somebody's typical squat, that naturally is going to challenge the core a bit differently. So again, understanding exercise modifications, but then also understanding the physiological considerations that may come along with changes in exercises. Maybe we have to modify movements because when they lay down on their back, they're starting to notice that they're being short of breath, or it doesn't feel great in their abdomen. Rule of thumb is ladies may continue to exercise on their back as long as they're feeling comfortable. And I've known competitive powerlifters who have benched all throughout their pregnancy. And I've also worked with other people who get to their second trimester and it's uncomfortable. We want to believe that the body would give us signals to let us know to get out of positions that we're not feeling great with. So, you know, you can kind of navigate that, but as a general rule of thumb, being on your back isn't evil. We're not going to have people sleep on their back, but The second trimester is where people might start to notice that they want to make modifications with movements because of their abdomen, and that might be supine exercises, so then that transitions into semi-reclined, or that might be more upright positions as well. Crunches aren't terrible in pregnancy. At some point, people's abdomens can't manage the challenge, so we might start to see symptoms, but lots of times people stop crunches because they don't really feel like it's doing anything anymore, and it does kind of get uncomfortable. Second trimester is where we want to become more aware of managing intra-abdominal pressure, because again, the core is changing. We are encouraging decreased breath holding with exercise because naturally holding our breath can increase intra-abdominal pressure. And we are looking at decreasing load because if we lift heavy things, it demands us to hold our breath. So just because the rest of our body or their body can manage the load and lift that 200 pounds doesn't necessarily mean that it's appropriate for their core system. There's increased load and demand. So being able to explain that, and then being able to find a way for somebody to, you know, what do they like about that heavy lift? Is it that they feel that tension through their hamstrings? Can we recreate that in a different position that doesn't have that need for all that loading? Maybe it's a burn in the glutes. Can we find a different exercise that can fulfill that for them, and really helping them navigate and say, we're going to put this load on pause for a bit. We are going to get you back to this. And these are the reasons why, and these are the potential benefits. But then also, if they want to keep going, again, that autonomy. Somewhere within the second trimester, lots of people naturally discontinue high impact exercise because it doesn't feel good anymore. When outside of pregnancy, jumping around, our internal organs are moving up and down. We just don't feel it because we're so used to it, right? Just like we don't feel the clothes on our body. So there are some practitioners who recommend no impact exercises into the second trimester. But if you got a runner, or you've got somebody who is a competitive athlete and they want to jump and it feels okay, we're going to look at all of those other training variables and we're going to modify those. So maybe it's volume. Maybe they're not doing a lot of them, but they want to keep that up. Same thing with running. Maybe their duration is different. Maybe it feels different if they run on an incline. So we can make those modifications, and, you know, also letting them know we don't have research to say that it might not cause symptoms. But we also don't have the research to say that it causes symptoms like leakage postpartum, or pelvic organ prolapse postpartum. So really a conservative approach is what I like to do, but it really depends on the person in front of me. And lots of times someone wants to keep an exercise, not because of the exercise but for another reason. So really getting down to the root understanding of why they want to keep that impact exercise if there's a lot of push to not stop. Third trimester. This is really where I have conversations with people about should I versus can I? So again, linking back into this risk versus reward. So just because we can doesn't necessarily mean that we should. Just because you can lift that 200-pound deadlift, maybe we should still decrease that load because we know the changes to your core, which includes your pelvic floor. We know the increased challenges on your cardiovascular system. And so breath holding and increasing that blood pressure right now might not be the best. And your long-term goal is to continue exercising. So how can we adjust this and modify that to align with your goal and still have you feel like you're getting what you want out of exercise and movement? Again, into the third trimester, we're continuing to adjust load, volume, and intensity, and changing exercises. In the third trimester is where I really shift with people to thinking more about birth preparation. And so, you know, looking at different positions that may really help to encourage pelvic floor muscle relaxation for birth, providing them with different stretches or positions maybe that they could utilize during labor and delivery, and they can practice that during their warm up or their cool down, whatever that exercise routine looks like for them. And I do offer birth preparation sessions, so one-on-one sessions or partner sessions. And there's so many different ways that people can find support during that third trimester to learn about labor and delivery. And then, of course, there's preparation for the environment that's going to change, for at home, putting in car seats, creating a room for the baby, creating another room for the sibling, putting two kids in one room together. So there's lots of things that start to really escalate in the third trimester. So lots of times exercise has to change because people are running out of time and people's bodies are also changing a lot. We're also preparing for after birth with the baby coming home. Like I had mentioned a couple of things, but also for after birth for the parents, prepping for understanding those first couple of weeks of recovery and rehab, prepping meals, asking people for help. Would you be around for a couple of days? You know, potentially, I can't give you an exact date because I don't know when I'm going to be, delivering, but it'd be really great if you could keep an evening free a week and come over and visit me and the baby, but also help with vacuuming. So there's lots of things that people can do to prepare for the fourth trimester, which is postpartum, that they don't realize that they could do during pregnancy. And again, that's that prehab approach. How can we best understand things now that will provide them support later? So exercising during pregnancy, people might have symptoms. People might have symptoms with day-to-day movements. Symptoms, from my perspective, encourage us to reevaluate where we currently are and help us continue towards our goals. So when people have symptoms, it's our job to listen, validate, and empower. Let them know that there's support. So in summary, really exciting, long presentation. Thank you so much for listening. We want collaboration, and if you're looking to learn more about this, you want mentorship and continuing education. Asking the person what they want, autonomy and individualizing the approach is going to be the best approach for supporting someone with exercise during pregnancy, and even supporting them day to day if they're having symptoms. Return to the basics. It's a good foundation for you to build off of. And be conservative. I like to say my approach is progressively conservative. It is always conservative because we don't have research to say it doesn't cause this, but we also don't have the research to say that it does, and vice versa, back and forth, back and forth. So being conservative is a great way to help people find ways to include exercise, but also potentially help to mitigate any risk. But with that, there's also going to be things that come up in postpartum that we can't stop from happening. So didn't really get into too much of that, but that's an important aspect of some of that prenatal education outside of exercise. All right, so thank you so much for listening, following along. This is my direct email address that you can take down. You can follow me along on social media as well. And then here's just some fun photos, workshop that I did a couple of years ago before COVID, and then the pregnancy and postnatal exercise class that I coach at Synergy. So for anything and all questions with women's health or pregnancy and postnatal considerations, please reach out. Looking forward to the lab. Thank you so much for listening, following along. Bring your questions, send your questions to Scotty or send them directly to me, and go back and review this lecture. I like to think that it's going to set you up for a really good understanding and be a really nice bridge to guide you into other continuing education if this is something that you enjoy. So cheers, everyone. Thank you.